Question. A 45-year-old female with a history of type 2 diabetes mellitus and obesity presents with a 3-month history of progressive fatigue, weight gain, and cold intolerance. On examination, she has dry skin, brittle hair, and delayed, deep tendon reflexes. Her TSH is elevated at 12.4 U/ml, and free T4 is low. What is the most likely diagnosis? A. Hashimoto's thyroiditis. B. Graves' disease. C. Subclinical hypothyroidism. D. Primary adrenal insufficiency. E. Pituitary adenoma. Correct answer is A. Hashimoto's thyroiditis. This patient's symptoms of fatigue, weight gain, cold intolerance, along with dry skin, brittle hair, and delayed, deep tendon reflexes, are classic signs of hypothyroidism. The laboratory findings, including elevated TSH and low free T4, confirm the diagnosis of primary hypothyroidism. The most likely cause in this patient is Hashimoto's thyroiditis, which is the most common cause of hypothyroidism in areas with sufficient iodine. Key features supporting Hashimoto's thyroiditis. Chronic autoimmune thyroiditis. Hashimoto's thyroiditis occurs when the immune system attacks the thyroid gland, leading to thyroid cell destruction and hypothyroidism. Elevated TSH. In primary hypothyroidism, the thyroid gland fails to produce adequate thyroid hormones, T3 and T4, leading to increased secretion of TSH from the pituitary as a compensatory mechanism. Low free T4. The low free T4 confirms hypothyroidism. Other findings. Common signs of Hashimoto's thyroiditis include fatigue, weight gain, cold intolerance, dry skin, and hair changes. The presence of delayed reflexes also points to hypothyroidism. Age and risk factors. This patient is in the typical age range for Hashimoto's thyroiditis, middle-aged women, and her diabetes mellitus and obesity increase her likelihood of developing thyroid dysfunction. Why not the other options? B. Graves' disease. Graves' disease typically presents with hyperthyroidism, which causes symptoms like weight loss, heat intolerance, tremors, and palpitations, opposite to the cold intolerance and weight gain seen here. Additionally, Graves' disease causes low TSH and high T3/T4 levels, not elevated TSH and low T4. C. Subclinical hypothyroidism. Subclinical hypothyroidism is characterized by elevated TSH with normal free T4 levels. This patient's low T4 makes subclinical hypothyroidism unlikely. D. Primary adrenal insufficiency. Primary adrenal insufficiency, e.g., Addison's disease, can cause fatigue, weight loss, and hyperpigmentation, but it typically presents with low blood pressure, hyponatremia, and hyperkalemia. This patient does not have those features, and the lab findings would show elevated ACTH and low cortisol rather than abnormal thyroid function tests. E. Pituitary adenoma. Pituitary adenomas causing hypopituitarism could lead to secondary hypothyroidism, but this would present with low TSH and low T4 levels, which is not consistent with this patient's elevated TSH and low T4. Key learning points. Hashimoto's thyroiditis is the most common cause of primary hypothyroidism and is an autoimmune disorder. It results in elevated TSH and low free T4. Symptoms of hypothyroidism include fatigue, weight gain, cold intolerance, dry skin, and brittle hair. Reflexes can be delayed. The TSH level is the best initial test for hypothyroidism. An elevated TSH with a low T4 confirms primary hypothyroidism, most commonly caused by Hashimoto's thyroiditis. Management overview. Levothyroxine. The standard treatment for hypothyroidism is levothyroxine, a synthetic form of thyroxine, T4, to normalize thyroid hormone levels. Monitoring. TSH levels are regularly monitored to adjust the dose of levothyroxine until the patient's thyroid function is normalized. Management of autoimmune thyroid disease. In some cases, Hashimoto's thyroiditis can be associated with other autoimmune diseases, e.g., type 1 diabetes, requiring comprehensive management.